Forget the bullet. Forget sterile gauze. Forget everything you've seen in a movie where someone digs around in a wound with pliers while the hero grits their teeth. That's fiction written by people who've never watched someone bleed out on a floor. Here's what actually matters. Pressure. Direct, unrelenting, physics-based pressure on the hole that shouldn't be there. Blood wants to leave. Your job is to convince it to stay inside using nothing but compression and the stubborn refusal to let gravity win. Find the hole. Entry wound, exit wound, if there is one. Whatever. Put something against it. Sterile gauze is ideal, but a t-shirt works. A sock works. A tampon works. Your bare hand works, because in the first 60 seconds, pressure matters infinitely more than sterility. Push hard, not movie hard, actually hard, like you're trying to compress the wound closed with your body weight. It's going to hurt them. Do it anyway because dead people don't feel pain, and you're not trying to win a kindness award. Your hand will get warm and wet, and you'll feel their heartbeat pulsing against your palm through the hole. That's good. That means there's still a heartbeat to feel. Don't lift to check if it's working. Every time you break contact, you reset the clotting process to 0. Blood has clotting factors, platelets, fibrin networks that need 3 to 5 minutes of static contact to build a plug. Give them that time. Push, hold, wait. The bleeding slows or it doesn't, but lifting your hand to peak guarantees it doesn't. If blood is pumping out in rhythm with their heartbeat, pressure is a comforting lie you're telling yourself while they bleed to death. Bright red spurting means you've hit an artery, and the heart is actively ejecting their blood supply onto the ground at roughly 70 milliliters per beat. You have minutes, not hours. Tourniquets aren't a backup plan. They're the plan. High and tight, above the wound, as close to the torso as you can get, while still being on a long bone. Forget Hollywood's gentle tourniquet applications. You're cutting off the entire blood supply to a limb, because saving the limb is optional and saving the person is not. Belt tourniquets barely work because they're too thin and dig into tissue without compressing the artery. Ratchet straps work but can destroy tissue if you're not careful. A torn shirt twisted with a stick. The classic windlass tourniquet works because physics doesn't care about elegance. Wrap the fabric around the limb twice. Tie a half knot, place a stick on top, tie it secure, then twist the stick until the bleeding stops. Width matters. Wide tourniquets distribute pressure. Skinny ones, paracord, wire, anything under 1.5 inches, they crush tissue and destroy what you're trying to save. Mark the time on their forehead with a marker or their own blood. This isn't drama, it's data. Hospitals need to know when the clock started, because tissue dies after roughly 2 hours without blood flow. Longer if cold, but don't gamble on it. This will hurt worse than the bullet. Do it anyway. Torso wounds. Don't follow the same rules because you're not managing a hole in muscle. You're managing cavities full of organs that weren't designed to meet outside air. Chest wounds can kill without visible bleeding because lungs need negative pressure to work, and a hole in the chest wall destroys that. Listen for bubbling, sucking sounds. Watch for one side of the chest rising while the other doesn't. That's a pneumothorax, and every breath is collapsing the lung further. You need a 3-sided seal, tape plastic, a credit card, a piece of plastic bag, anything non-porous over the wound, but leave one side open. It's a one-way valve made from trash. Air escapes when they exhale but can't get sucked back in when they inhale. Tape 3 sides, leave the bottom open. Check that the chest rises evenly. Abdominal wounds are a different nightmare. Intestines outside the body look worse than they are, but they're also a bacteria time bomb. Do not push them back in. Cover them with a moist dressing. Clean cloth soaked in water, whatever you have. Position them on the wounded side if possible. Internal bleeding is the invisible killer. No external blood, but the abdomen is a huge space where blood can pool and hide. Cold clammy skin, rapid weak pulse, distended belly, confusion. Those are the signs you're losing the fight from the inside. Torso wounds without surgery are dice rolls. These steps buy time. That's all you've got. You can plug every hole, and they'll still die, because the body has a failsafe that kills people trying to save them. It's called hypovolemic shock, and it's what happens when blood volume drops and the cardiovascular system starts making executive decisions about which parts of you get to keep living. The brain and heart get priority. The extremities get sacrificed. You'll see it. Paler gray skin, cold clammy hands and feet, rapid weak pulse you can barely feel, confusion, anxiety. A sense of impending doom that's not psychological. It's cardiovascular collapse announcing itself. Their body is shutting down to conserve what's left. Your job is to convince it there's enough to keep fighting. Get their legs elevated 12 inches, torso flat or slightly raised. You're using gravity as a pump to return blood to the core. Keep them warm. Blankets, body heat, anything. Hypothermia plus shock is a death spiral because cold blood doesn't clot, and a cold body can't generate the energy to fight. Water helps, but won't replace blood volume. Don't waste time forcing drinks if they're altered or unconscious. What not to do. No alcohol. It's a vasodilator that drops blood pressure further. No stimulants. Don't let them stand or walk. Keep them talking. Ask questions. Make them answer. Keep them engaged because the brain shutting down is the point of no return. Shock is the body trying to survive by killing itself slowly. Override it. Surviving the bullet just starts the clock on bacterial invasion. Gunshot wounds are pre-contaminated because the bullet carries fabric, dirt, and skin debris deep into tissue where your immune system can't easily reach. Bacteria don't wait for permission. They start colonizing in hours, multiplying every 20 minutes, turning dead tissue into a feeding ground. You've got 6 to 12 hours before a serious infection, 24 to 48 before sepsis, which is when the infection goes systemic and your body's inflammatory response starts destroying your own organs. Clean the wound. Irrigation matters more than sterility. Pour water through it. Literally flush the wound channel if you can access both entry and exit. Volume beats purity. A liter of tap water is better than a splash of sterile saline. Debridement is the nightmare step nobody wants to do. Dead tissue is bacteria food, and it has to come out. Cut away black, gray, or foul-smelling tissue with a sterilized blade. It's horrifying, but necessary. Antibiotics if you have them. Fish antibiotics if you're desperate. Garlic or honey if you're praying, because they have weak antimicrobial properties. Cover the wound, but check it daily. Red streaks radiating outward, heat, swelling, pus, smell like rotting meat, fever above 101 degree rare. Those are infection announcing itself. The dark calculus. Infected limb now, or amputate later. Bacteria don't care about your survival story. They're just trying to eat. Make yourself inhospitable. Pain is information. It tells you when something's getting worse, when you're re-injuring tissue, when infection is setting in. You need some of it to survive, but too much pain triggers its own sympathetic overload that dumps adrenaline and cortisol until the body tips into shock from the stress alone. You're walking a line between alert enough to stay alive and numb enough to function. The hierarchy. Actual painkillers, if you have them. Ibuprofen or acetaminophen for inflammation, even though they won't touch gunshot pain. Alcohol as a last resort, because it thins blood and impairs judgment. But sometimes, screaming pain prevents basic wound care, so you make the trade. Ice or cold packs work through localized nerve blocking. 20 minutes on, 20 minutes off. It reduces swelling and numbs the area enough to think. Psychological techniques sound like nonsense until you're using them. Controlled breathing, 4 seconds in, 7 seconds hold, 8 seconds out, forces the parasympathetic nervous system to override panic. Pick a focal point. Talk through it. Anything that redirects attention from the pain signal. Do not use opioids unless you know the dose because respiratory depression kills people in their sleep. Positioning matters. A 15-degree angle shift can move tissue off a nerve and turn unbearable into bearable. You need them alert enough to tell you if things get worse. That means they're going to hurt. That's the deal. Medical supplies are just clean trash someone decided to sell for $50. Go backwards. Sterility is a spectrum, not a binary. Clean enough beats dirty, but it doesn't need operating room standards to save a life. Dressing materials ranked by what actually works. Menstrual pads are literally engineered to absorb blood and stick to fabric. Diapers have superabsorbent polymers that hold fluid without dripping. Tampons work for narrow, deep wounds, despite the controversy. T-shirts and towels work for everything else. Paper towels are a last resort because they disintegrate when wet. Tape. Duct tape is skin-safe enough for short term. Superglue is medical-grade cyanoacrylate under a different label and seals small lacerations. Strips of plastic bag tied tight work when you have nothing. Irrigation tools. Water bottle with a pin-sized hole punched in the cap. Turkey baster. A straw to blow water through. Anything that creates pressure to flush debris. Gloves. Plastic bags over your hands. non-lubricated condoms over fingers, or just wash your hands with soap for 60 seconds and accept the risk. Antiseptic hierarchy. Rubbing alcohol stings but kills. Hydrogen peroxide foams out debris. Vodka at 80 proof barely works, but it's better than spit, boiled salt water, or just the hottest tap water available. Tools. Lighter sterilized knife for cutting dead tissue, tweezers for debris, nail clippers as improvised scissors. Medical supplies are marketing. You already own the materials. Not all gunshot wounds are survivable, and pretending otherwise wastes resources and prolongs suffering. Know the difference. Survivable. Extremity wounds that miss major arteries. Single torso punctures that avoid vital organs. Through and through muscle wounds, where the bullet passed clean. Probably fatal without surgery. Liver, spleen, or kidney damage with internal bleeding. You can't see or stop. Major vascular injury to femoral or carotid arteries. High chest wounds near the heart. Unsurvivable even with a hospital. Catastrophic head trauma where brain matter is exposed. Aortic arch penetration. Multiple abdominal organs destroyed. Signs of imminent death. Unconscious and unresponsive to pain. Pulse barely palpable or absent. Agonal breathing that's irregular. Gasping not actual respiration. Gray or blue skin tone spreading from core outward. At that point, your interventions are just adding chaos to a body that's already shutting down. Sometimes doing everything means keeping them comfortable and present instead of frantically packing gauze into a hole that won't matter in 10 minutes. There's no Hollywood redemption arc here. Some wounds are mathematically fatal, and fighting that wastes the time they have left. Make the call. If they're still breathing when real help arrives, you didn't get lucky. You won. Hospitals just have better supplies, and someone else to blame when things go wrong. You're not a surgeon. You're a plumber stopping leaks and a guard keeping bacteria out. That's enough.